Hi, everybody. It's nice to see you. Happy New Year. It's Valerie Seer, the owner and one of the two clinicians at Nutrition Connection Balance. I know that a lot of you have gotten reminder calls and that you're familiar with our male, female, and adrenal stress hormone clinic, but I want to strongly encourage you to continue to test and refer friends, family, colleagues that need hormone help. We want to make sure that you get registered by this Friday, February 23rd, and the very latest you can get your samples in are March 4th and sooner. So it's done by saliva and urine, unless you just do the adrenal stress clinic, then it'll be 4 samples of saliva. But let me just really encourage you a few reasons to get them. Remember, there's 3 estrogens: estradiol, estriol, and estrone. In a woman, we test all of them. In a man, we test estradiol. Estradiol in a man can be indicative of prostate, urinary, or heart disease. If it's getting too high, and there's therapies and lifestyle changes you can do that prevent things way before they happen, or if you already have rising PSA or urinary issues or heart health, be very protective. For women, we look at all 3. Estradiol has over 400 functions. Estriol, postmenopausally, especially affects vaginal dryness, tissue changes, as well as urinary changes and bone density and tissue health. We know that estrone is really helpful to monitor, and we look at it if you're on estrogens, or it can tell us if there's binding issues or other issues that could also relate to conditions such as cancer. So it's really important to test those. When we look at progesterone, for a man, it should be very low typically, but if it's high, there's new research showing that it can be, again, a sign of heart disease. And if we think that's true, there's other markers I'll ask you to test, and we can look at that. And lifestyle is one of the best ways to actually address that, of course. And then we look at testosterone. Testosterone is the major hormone in a man. There's a lot of things men can do besides testosterone, and we want to do supportive things, whether you choose testosterone or not. And then when you use it, make sure you're protecting yourself and your family, especially the women in the home. And then with women, testosterone is best addressed through DHEA, because that way there's less symptoms, it's less expensive, and it has multiple other factors. DHEA and testosterone support each other in men, but it's not a direct pathway. DHEA affects lean muscle mass, bone, memory, cognitive functioning. New testing and new study results are showing that it has to do with erectile dysfunction, even sensation. So there's all sorts of important things that we look at. Cortisol, everybody knows because of TV, and cortisol is a stress hormone. But what you don't know is that you could have symptoms that sound like it's high, but it could be too low. Or one of the most common profiles that I see since COVID is called an erratic profile, which means you have high and low. The body's a little confused from overstress, multitasking, and you really need therapies that are individualized. We look at all of those hormones in our clinics, or again, if you just want to do the adrenal stress hormone clinic, then we do 4 cortisols, 1 saliva by 1 DHA by saliva, and that's fine. So you can go to our website, nutritionconnectionbalance.com, under shop to register for any clinics. You can call our office at 850-227-7931 or email ncbteam@nutritionconnectionbalance.com. There's time to get in this week. We're closed on Monday due to the holiday. And just remember, you can leave a message or say what clinic you need, and we'll get that sent out and registered right away. Please make sure you leave your information, your phone number, anything we need to make sure that you get registered on time. So we are really happy to continue to address your health. We are really enjoying our Florida office, almost a year here already. It's amazing how fast time goes. And I hope that you are really looking at, we have so many different new tests and advanced tests, especially for aging. There's a new documentary called, oh my gosh, I forgot what it's called. It's on the twin study by Stanford University on Netflix. Really interesting study. And they look at telomeres. I've been testing telomeres for years. It's a really kind of fun test also, because you can look at your changes through diet, exercise, and even supplementation, and how it affects actually aging on your genetic markers. So a lot of different things that we offer. If you're not familiar, again, go to our website under shop. You can see all the different tests we do. And of course, we have many different handouts and free education also under our website. So again, we look forward to helping you stay healthy, and thank you so much.